Hi guys, I will be going over my experience with the Adaptive Behavior Assessment System 3rd edition, or ABAS 3. The ABAS 3 is used to create a complete picture of functional skills for individuals of all ages. The items focus on practical everyday activities required to function, to meet environmental demands, to care for oneself, and to interact with others independently. So there are 11 different skill areas assessed within 3 major domains, which are conceptual, social, and practical. The ABAS helps with identifying the students' adaptive behavior strengths and weaknesses. So the reason I had to administer the ABAS 3 was because I did not have access to the Vinland assessment. The diagnostician who is helping me out mentioned that they don't really use the Vinland at all in her school district anymore. They only use the ABAS 3 to assess adaptive behaviors. She also recommended I use the parent primary caregiver form instead of the teacher form, since the child I was going to give the assessment to is below the age of 5, which was 4.1. She also explained that they will usually only administer either the parent form or the teacher form. But if for any reason the diagnostician feels like either the parent or the teacher was not fair with their scores, then they will administer both to compare the results, and that way they will be able to obtain a more accurate score. Also, she explained how they will use the ABAS as a way to help them determine whether the child should be labeled with a learning disability or not. So I asked one of my patient's parents to see if they were willing to administer the assessment to their daughter. She is currently attending speech therapy for an expressive language delay. So her delay is not severe, but she is a bit shy and reserved, so it makes it a little bit more difficult for her to communicate. So the reason I chose her was because she's a really smart, well-behaved little girl, but mom has been communicating with me recently that she does have concerns with her behavior at times. So she tends to just shut down for no specific reason. About a week ago, she was also struggling to get her to brush her teeth and take a bath. She would just cry and say she was scared. So mom didn't know why she was behaving like that for no apparent reason. So when I told mom about this assessment and how it would help give us a better understanding of her daughter's adaptive behavior strengths and weaknesses, she was all for it. So mom does speak primarily Spanish. She understands English, but I think reading it was a little bit tough for her, or understanding what the questions were asking. So I helped guide her through it. So I pretty much just explained to her that there is a 4-point rating scale. So if she felt like her daughter was not able to do the task, she would choose a score of 0, 1 if she was able to, but rarely ever did it, 2 for sometimes, and 3 for always. So it was pretty simple to explain to mom how the assessment worked. It took her about 30 minutes to complete it. She felt like it was a lot of questions, but she didn't have any difficulty answering any of them. So they were pretty straightforward. I went over the questions myself also, just to see if our answers would have been different, but I felt like I would have answered them pretty close to what she chose. So the diagnostician helped me input the scores in a computer-based program, which was also pretty simple. And the report with the results is really detailed, so I thought that was pretty awesome. Um, and I also like that at the end of the report, they give you a short summary of the overall results, which is, or makes it pretty simple to be able to explain the results to the parents. So it was an overall pretty good experience.